Hello, everybody, and welcome to this episode of the Academy of Biomimetic Dentistry's webinar series. Today, I have one of my friends and a colleague of the ABD, Dr. Alireza Sadr, and he's joining us today to talk all about a subject matter that is, well, I'll let him describe it, but it came about of a very interesting way because he was doing a presentation and he got stuck on a slide for almost an hour. And he's like, wow, I hit on something here that people really want to hear about. Dr. Sadr, what are you going to be talking about on this webinar?
Hi, everyone. So the story is here that I was having a small group, a hands-on course here in Seattle. And I always start with some introduction slides talking about caries management, talking about the new ways to manage caries and treat severe decay patients. And I showed a case that we did at the University of Washington. And then that case generated a lot of interest about how we actually got that patient from the point that they were until the point that we said you're done with your treatment. So I thought maybe that subject is worth talking about for more than just slide. Maybe I can go deeper and dive into the subject of management of high caries risk patients and rampant caries, basically.
That's interesting. So if you had to put a subject line on what this case was or this case study was, what would the subject line be? Like, what's the highlight?
Yeah, well, I don't want to give too much information
Of
away,
course.
but this is the methodology that we have developed, worked in some patients, and of course, there is a lot of literature on it with the combinational use of silver diamond fluoride and conventional glass ionomer for deep dentin caries. So that's basically what it is. And again, it's a researched and published subject for us.
Perfect. So you're going to be breaking out an entire case study from this particular case and showing. Will you be showing from maybe beginning through the end of it and what was done?
Yes, exactly. And of course, I always have something to say about the philosophy behind it, something about why we're doing it. It's a story of a patient with methamphetamine use, and they wanted to go to rehab, and they had all these issues with the appearance of the teeth. And basically, there was no way for them to keep the teeth except for what we did. So I will not only show the case, but I will show the research behind the case. And we have very recently published a paper that sort of gives a strong, say, basis for the way that we do things with this technique. So yes, I'm going to show the steps as well as the research behind these steps.
What do you think is the one or two most interesting things that if a new dentist or somebody who's newly exposed to biomimetics would take away from coming to this lecture?
I think management of deep dentin caries with the help of SDF and GI and the exact protocol and indications, and of course contraindications of that is a takeaway point. I'm almost confident that this is a sort of new subject for everyone because this is a developing story. It's not new to
Great.
me. Yeah, it's not new to me because I was trained in Japan and they did this since 1960s and 70s. Not exactly in the same way as we do it, but
They're always ahead of the curve over there.
sometimes.
So you're actually pulling some futuristic stuff and bringing it back to us over here in the United States and the rest of the world, huh?
Yeah, maybe we can look at it that way. Maybe we can look at it that way. I'll have a little bit about the technology that we also developed for diagnosis of caries. It's a 3D in-depth imaging technology called optical coherence tomography. That is really wonderful, something we never had. You can take an image of a tooth in 3D and look at it, and instead of guesstimating where the decay is, you can have a 3D actual presentation of that on your screen. So that's another subject that I will talk about, and that is really much more futuristic than what the Japanese had in 60s.
So just to recap, what are we going to learn on our first webinar with you, Dr. Sadr?
So the first webinar that I will do for ABD, I will go over the philosophy of care that I have. Then I will talk about management of caries, caries risk assessment, as well as management of rampant caries cases. And I will also go over optical coherence tomography as a new technique for detection and characterization of caries.
And if you had to take a guess of who this is mainly for, I already know your answer. You're going to say it's for everybody, but who is it mostly for? If someone is new to us, or maybe even not new, can you kind of guide me on that? Like, who should attend?
I don't want to go with the everyone, but I think there is something for everyone in there. Definitely, there's something for my research colleagues, my students, my everyday, colleagues that see patients on a daily basis. So, but I'm trying to gear it more towards general practitioners, dentists that are dealing with the most common disease of oral health, which is caries.
And how does this fall inside of the biomimetic model or paradigm?
Well, that question I should probably talk about for about 2 days or 2 days and a half.
You got to show up to answer that question, right?
Yeah, you got to show up to answer that question. Yeah, but to me, biomimetic dentistry is a series of methodologies based on research for tooth preserving dentistry, for maximizing patient satisfaction, for minimizing unnecessary root canals and crowns, full coverage crowns. And people know I have specifically some issues with the full coverage crowns. But anyways, I think it's very well in line with what biomimetic dentistry is. But it is much less talked about, because we've always talked about, how to restore a single tooth, right, or several teeth. But we've really never talked too much about rampant caries cases. So yes, it's new for the biomimetic dentistry or biomimetic meetings that we have had, but it's 100% in line with the philosophy.
I love it. Well, this is your little sneak peek to Dr. Alireza Sadr and what we'll be talking about on our upcoming Zoom meeting. We want everybody watching this to please register and please show up. And I think that's it. Hey, doctor, thank you so much for doing this with me today.
Thank you for the opportunity.